What do you think, Dr. Turner?
This isn't my decision.
I know that. I'm asking your opinion. Without the surgery, how long does he have?
Not long. Months, weeks, days.
What would you do if it was your son?
Mr. Archibald.
Not you. Him.
I would do the transplant. Absolutely.
Okay. Let's do it.
The first step is to get Mike's name on an organ recipient list. Once he does, his chances are very good. Your son has an extremely rare type, so there isn't a big demand for B positive blood. Your son can move up to the top of the list right away.
It's not that simple. There are other considerations before a prospective recipient can be placed on the donor list, Mr. Archibald. The cost for transplant surgery can be very expensive. In most cases, prohibitively so.
I've got major medical. Don't worry, I'm covered.
Actually, we've already checked with your provider, and there's no provision in your policy for a procedure of this magnitude.
There must be some mistake. My son is covered. I have full medical. He's covered.
What about you, Mrs. Archibald? Do you have coverage?
No. I've only been working at the market a short time. You need to be there 2 years before you get benefits.
I see that you don't own your home, no investments, stocks, bonds, and you have a little over 1,000 in savings.
Did you hear what I said? I'm telling you, I'm insured.
That may very well be the case, but you're going to have to check with your provider on that. In the meantime, I'm afraid we have to treat you as a cash account.
How much does a transplant cost?
Transplant surgery, doctor's fees, post-operative treatment, and immunosuppressant drugs. You're looking at $250,000 minimum.
What are you saying? If I don't come up with $250,000, you're not going to treat my son?
We have treated your son. We continue to treat your son. Now, I understand how upset you are, sir. But with other options available, the hospital is not obligated to cover a procedure this costly. If you opt for replacement surgery, that is your choice. But the hospital has a very strict policy with regards to cash patients. We require a down payment before a patient's name can be placed on the receiver list.
What kind of a down payment?
30%. $75,000.
$75,000 to put my son's name on a list?
Our son is upstairs dying, and all you can talk about is money?
Yes. It takes money to provide health service. It is expensive for you and for us. Now, my job is to keep this program alive for everyone. I'm sorry, but we need you to guarantee payment before your son's name can be placed on the list.